Good morning. In 3 weeks and sooner in some school districts, kids are heading back into the classroom. It's the ideal learning environment and one that most students have had away from them for a year as a pandemic has upended our normals. Students 12 and older are eligible for the COVID-19 vaccine, and many parents are working to get their teens vaccinated as part of the back-to-school checklist. But for our younger kids, they are not yet eligible for the vaccine. As a result, there is understandable anxiety. The Delta variant is more contagious, and it's quickly driving up hospitalization numbers. The Pandemic Task Force reported Friday that 493 people were hospitalized with COVID-19, up from 93 2 months earlier. Low vaccination rates are driving these numbers, and those working in pediatric units are seeing younger patients struggling with the virus. And that's why masks are so important for everyone to wear now. We must protect our children and the unvaccinated from harm, and masks are the best way to do this. Many of the schools in our region are requiring masks this fall. There is simply too much risk without putting some protective measures in place. We're seeing more and more businesses requiring them as well to protect employees and the public. Unfortunately, the County Council voted down a mask requirement that would have protected us all, most notably our children and the unvaccinated. Now we wait for the courts to rule. This was solely a political decision that ignored the advice of medical experts, guidance from the CDC, and recommendations from the American Academy of Pediatrics. This dangerous vote by the County Council has brought confusion, anxiety, and anger. Most importantly, the move could sicken more of our children who are not yet able to get the vaccine. We are seeing younger people in our ICUs battling COVID-19. In Louisiana, 3,000 children tested positive for COVID-19 in 4 days. That's 3,000 children. These are startling numbers. Children who test positive for the virus can spread the virus to adult family members who are unvaccinated, and it's older people who most commonly have poorer outcomes. I know that many of you support and respect the decision of public health professionals and want to do whatever it takes to get control of the virus. So I urge you to contact your council members, call or email them, and tell them where you stand on masks and other public health protocols. Tell them you want your kids to be able to stay in school this fall, that you want to avoid any further restrictions, and that we need to do everything possible to keep the economy strong and people employed. Masks and vaccines are the 1-2 punch in containing the virus, and the council should be doing all it can to get that message across. At its recent meetings, the County Council heard from people who are against masks, vaccines, and most public health decisions made to keep us safe and slow the virus. I understand the majority of people support public health decisions, but don't want to be in the same room with unmasked people who share false dark web talking points. The majority of the council members have said they support mask requirements, but did not like the way the initial mandate was put into place. There's an easy fix to that. The council can adopt its own mask requirement on Tuesday night and let the legalities of the initial public health order on masks play out in court. Time is of the essence. Kids are heading back to the classroom to make new friends, to see old friends, prepare for their future, and create lifelong memories. Let's not let inaction stand in the way of that moving forward. Wearing a mask protects our future. Too many people remain unvaccinated, and our young children are not able to get the vaccine. We must wear masks for them. I recognize the personal liberty argument of all of this, but I can't see past risking the lives of others. Personal responsibility and personal liberty are not mutually exclusive, especially when a pandemic is showing us that it's not quite done with us yet. Let's look at some of the most recent numbers. In St. Louis County, we're averaging 311 new cases per day. That's 6 times the number from about 2 months ago. Our infection rate climbs to quickly pass where it's been in the past 2 months. It's currently at 11.7% compared to just under 4% at the beginning of June. You can see on the next slide where we are with the percentage of residents vaccinated, with just over half of our community receiving at least one slot. We continue to have a higher vaccination rate than most of the state, but we are still far from where we need to be. And on this slide are some vaccination events this week. A complete list of where you can get a free vaccine can be found at revivestl.com. It's only with United Front that we get the pandemic under control. Masks and the vaccine together are our path forward. I'd be happy to take any questions.
Coming from the newsroom, they want to know if you still stand behind Dr. Khan and you still have confidence, full confidence in his leadership.
Yes, I'm impressed with the work of Dr. Khan during the pandemic. I think he's doing a good job. Any other questions? Okay, thank you.